about for years. The peace of mind that comes with having insurance and the increased premium subsidies helped to make it possible to launch Renzo's Fire, my own Cuban catering business. President Biden knows the peace of mind that comes with having good, reliable health insurance. He is fighting to protect health care for hardworking families like mine. He is fighting to stop Republicans from cutting health care benefits. I am also so thankful for the President's leadership to cap the price of insulin for my son Bauer and the 200,000 other American children with type 1 diabetes. It is my honor and the honor of my life to introduce the President of the United States, Joe Biden.
Thank you, Teresa. What a lovely introduction. You have such grace and calm and charm. I said on the way out, I said, if it gets confusing, just say, here's Joe. Okay. Look, 13 years ago today, we gathered in this room as President Obama signed the law on affordable health care. Hard to believe, 13 days. 13 years ago. It seems like 13 days ago. I think it was the most consequential, I think most people agree, the most consequential piece of healthcare legislation since the creation of Medicare and Medicaid in 1965. Talked to the President yesterday, got a chance to speak with him, he did a little thing together. And it's an extraordinary achievement by President Obama. And while the Affordable Care Act has been called a lot of things, Obamacare is the most fitting description. Many of you joined us that day after fighting for decades to make it happen. I remember 3 words I used at the time. I thought it was a big deal. And I stand by the fact it was a big deal. So I also called it that time a historic day. Because history is not merely what's printed on walls and textbooks. You know, it doesn't begin or end with a stroke of a pen. History is made when women decide that there's a greater risk in accepting a situation they cannot bear than stealing our spine and embracing the promise of change. You know, no one has more in her spine than the greatest speaker in the history of this country, Nancy Pelosi. Nancy, no exaggeration to say, this would not be well without you. It would not be well without you. I want you to speak of the relentless push to get this law passed and then defend it every single turn. We wouldn't be here today. And Kamala, I want to thank you for everything you've done to defend this law as Vice President. As United States Senator. As Attorney General, along with my son, Beau Biden, you both brought cases to defend it. And I also want to thank Kamala for her leadership and fight to protect reproductive rights for women. So many of you here worked so hard to make history 13 years ago today. And I just want to start by saying thank you. I mean it from the bottom of my heart, thank you. There's millions and millions of people who owe you. because you stuck with it and you keep defending it. 13 years later, it's easy to forget what life was like. A hard-working family before your Affordable Care Act. You know, but all of you remember. Remember when a parent with a heart disease, or diabetes, or a child with asthma couldn't get coverage because of a pre-existing condition? Remember when women had to pay more for insurance because they had a pre-existing condition? They were a woman? It's not a joke. It's said today to people, they look at you like you're kidding me. That was the case. Remember when you couldn't leave a dead-end job because you couldn't risk losing your health insurance? Remember when a 22-year-old kid could get kicked off his parents' plan because he graduated from college? Remember the donut hole when seniors on Medicare reached the point every year when they had to pay the full cost of the drugs out of pocket? Remember when millions of low and middle income families, particularly those families, were locked out of health insurance because there was no way they could afford it? None. I said earlier, my friends heard me say this before, I can remember we lived in a 3-bedroom split level home. My bedroom was up against the wall of my parents' bedroom. My dad's headboard was there. And I remember when I was 14 years old. I remember my dad, I could see, he could hear he was just restless. And I asked my mom the next morning when I worked last night, I said, well, this company just told me we're not going to pay for health insurance anymore. How many people lie in bed awake wondering? Remember when insurance companies could cut you off halfway through chemo? Because you reached the limit, what they were willing to pay? I remember, I talked to you about this, Chris, when my son Bo was dying of chemo, dying in the hospital because he had stage 4 glioblastoma. And I got a call from someone asking me for help because they thought they were going to have their insurance cut off because they ran out of time. I thought to myself, what in God's name will I do? They come along and said, sorry, you've run out of your coverage. Folks, the most vulnerable point in a person's life, the moment where you really need it, you hear the word sorry, your insurance has run out. Folks, our MAGA Republican friends, let me be clear. There's some good, decent Republicans out there. I'm not suggesting it's all about the bad Republicans. But this new crowd is, it's not your, this ain't your father's Republican Party. They may have forgotten all that I said, but I haven't. You haven't. All Americans deserve a peace of mind that if no one strikes or an accident occurs, you can get the care you need. But the truth is, too many folks lie in bed at night and say, look, stand at the student wondering, my God, what happens if she gets breast cancer, or I end up with a serious cancer, or what happens to the kids? What then? What then? Do we have enough insurance? Can we afford the bill? What's going to happen? If it gets bad enough, maybe we have to sell a house. We don't have more equity. You know, I think it's about what you value. I think all of us in the room value peace of mind for everybody. Everybody deserves a little peace of mind for things they can't control. That's why my administration is focusing intensely on building on the progress in the Affordable Care Act, getting more people affordable insurance, lowering prescription drug prices, giving families more breathing room. We have passed historic laws to get that done. And now we're moving quickly to implement them so people can feel the effects in their everyday lives. The Affordable Health Care Act expanded Medicaid to cover an additional 20 million people. Before it was passed, 20 million people fewer people had insurance. So it expanded to cover 20 million more people in Medicaid. That means more cancers detected early, more mental health treatment available, less medical debt, fewer evictions. I signed the American Rescue Plan, which went further in a lot of states to extend Medicaid coverage to new moms for up to 1 year after they gave birth instead of only for 60 days. You remember, Bill, what that did, if you guys did. 36 states and counting. Now we're expanding to a full year coverage. The Rescue Plan also increased coverage and lowered prices for the Affordable Health Care Act by saving 15 million people close to $800 a year on their insurance. Our new budget makes these savings permanent. finished the job by expanding Medicaid to at least 2 million more Americans. So forth. Making health care more affordable in many other ways as well. Last year I proposed and the Congress passed the Inflation Reduction Act, which no Republican voted for, even the good ones. I don't mean good in the moral sense, I mean normal. As a result, this year, seniors on Medicare now get common vaccines, things like tetanus, whooping cough, shingles. They get them for free instead of having to pay up to $200 a shot. Americans spend more on prescription drugs than any advanced nation in the world. But for decades, we worked for decades, and I did this with Chris a long time. I say Chris has done her job a long time. We tried to take on big pharma. We finally won. And instead of just paying whatever drug companies want to charge, Medicare is going to be able to drive down prices. We gave Medicare some of the same powers, again, the same powers to do with Medicare. We gave the government the same power to be able to do what they can do with the Department of Veterans Affairs, negotiate low drug prices. There's another example. There's another example how we're lowering costs. Insulin was invented 100 years ago. It only cost about $10 a vial to make. The drug companies are charging hundreds of dollars a vial. But beginning January 1 of this year, we capped that cost at $35 a month. But we need to cap that cost for everyone, including the 200,000 children with type 1 diabetes who need insulin every day to stay healthy and alive. So I call on Congress to do that as well in this budget. My budget's going to require it. But guess what? Earlier this month, Eli Lilly, I spoke to the biggest insulin maker in the country, announced they're answering my call. They're lowering prices at $35 a month. Last week, the country's 2 of the top insulin makers announced they're cutting prices as well. So, folks, and here's something else the Inflation Reduction Act does to lower prescription drug costs. Drug companies that raise prices faster than inflation. Now, that's right, we like babies. You know what I mean? It's okay. It's all right. I like babies better than people. But look, any drug company that raises prices faster than inflation now has to pay Medicare back the difference. Getting next. Last week we learned that drug companies hiked prices on about 20 drugs above the new threshold last quarter. Now, manufacturers are going to have to pay the difference back to Medicare. The Department of Health and Human Services estimates it will make co-pays for those drugs hundreds of dollars cheaper for some seniors. And it's going to change the way these drugs are priced and lower costs for seniors long term as well. We also are capping out-of-pocket drug expenses for seniors on Medicare at a maximum of $2,000 a year total, no matter what it costs them. Look, that's compared to a lot, and you know, maybe some of you in here know folks who are paying not just $2,000, you're paying $10,000, $12,000, $14,000 a year for some of the expensive treatments like cancer drugs. But they'll never have to pay more than $2,000 for all their prescriptions in a single year. And we're going to give seniors certainty and peace of mind. And by the way, we're also going to give the federal government the money as well, lowering the deficit by $160 billion. Because they don't have to pay out that much money. 2 weeks ago, I released my budget, and it lays out what we support in a stark contrast to the other team. My dad used to have an expression, Christine, my dad. He said, "Don't tell me what you value. Show me your budget. I'll tell you what you value." Don't tell me what you value. Show me your budget, and I will tell you what you value. Well, I value everyone having a decent shot. It's about fairness, it's about dignity. My budget continues to build on the progress we made in the Affordable Care Act. We value seniors, hardworking Americans who busted their necks their whole lives. My budget was a burden on those folks so that at the end of the month, they had just a little bit of breathing room. Just a little bit of breathing room. No one making less than $400,000 will pay a single penny more in federal taxes to pay for all that we have. Not a single penny more. But our MAGA Republican friends in Congress have a very different value set. They want to repeal the Inflation Reduction Act. They value big pharma over lowering drug costs for seniors. We're trying to undo the Affordable Care Act ever since I started. And this started 13 years ago. They voted to repeal or weaken the act 50 times in the first 5 years of its existence. They made repealing part of it virtually every Republican, in every single Republican budget since the law was passed. And they're backing plans that would gut it again, gut Medicaid. Look, let's take a look at what the Affordable Care Act has done. The Affordable Care Act is the big reason why millions of people with pre-existing conditions can afford to have insurance premiums. Because of the Affordable Care Act, millions of Americans get free preventive care like cancer screening. And by the way, saves the country millions and millions of dollars if they're detected early. Because of the Affordable Care Act, millions of Americans have access to basic services like maternity care when they wouldn't otherwise have that. Because of the Affordable Care Act, families all over the country have been able to keep their children on their policies until age 26. Today, North Carolina is about to become the 40th state to expand Medicaid. There are nearly 40 million Americans in this country who get their health care through the Affordable Care Act and the Medicaid expansion. 14 million people of some peace of mind. The Affordable Care Act has been law for 13 years. It has developed deep roots in this country, become a critical part of providing health care and saving lives. We always talk about the cost, but it saves lives as well. Obviously, it doesn't mean much to our Republican friends, but it can be a matter of life and death to millions of Americans out there today. Even now, every Republican in Congress are intent on repealing the Affordable Care Act when it's clear it would have a devastating impact on the American people. We still have the House Republican, we still haven't seen the House Republican budget. They want to negotiate. I say, I lay down my budget tonight, you lay down yours, let's negotiate. I don't know where the budget is. No, I'm serious. There is no budget. As my brother would say, go figure. Look, the budget's going to show what they value. A former Trump director of budget advising the MAGA Republican in Congress has a plan to slash $2 trillion from Medicaid. I guess that shows a little bit of their value statement. He wants to end Medicaid expansion of the Affordable Care Act and make additional deep cuts that could lead to nearly 70 million people losing critical services. 70 million people. Most of them are seniors, people with disabilities, and children. And children, I should say. And some could lose their health care altogether. There are a number of other areas that cutting Medicaid or repealing the Affordable Care Act would have a huge impact. You know, what people don't really understand, my Republican friends always talk about how they care about rural America. Well, guess what? Let's take a look at rural America's hospitals, which lose funding. They need to keep the doors open. That's one of the reasons why some of them are closed. Already, rural residents have to travel twice as far to get to a hospital as folks who live in cities, which is partly why trauma patients in rural areas are twice as likely to die before they get to a hospital. And more would close. Not a joke, more would close. You couldn't stay open. If our Republican friends get their way, more rural hospitals will shut down and probably get worse. So I don't want to hear about the value of rural America. If they get their way, seniors and people with disabilities could lose access to home health care, and with it, the ability to stay in their home, which, by the way, shows and extends life of the people. People would much rather stay if they could, just a little bit of help in their own home, rather than go to a home. And it's less expensive. Medicaid also pays for nursing home care for about 2/3 of all Americans who live in nursing homes. Well, it'd be different if they're able to stay home. Medicaid and quality of care in nursing homes goes down when that happens. Millions affected by the opioid epidemic lose access to drug treatment. and for the millions of middle class and working class currently covered by the ACA marketplace. Even if they manage to keep their insurance, it can cost them thousands more each year. That's just a glimpse at the damage the repealing the Affordable Care Act would have on anybody Medicaid. We do. But our value set is fundamentally different than our Republican friends. So we will never let that happen. We're also strengthening Medicare and Social Security. In fact, my budget will extend the life of Medicare Trust Fund beyond 2050. And meanwhile, not the Republican Congress, my Republicans are threatening to gut and eliminate these programs. You may have seen our back and forth in the State of the Union. Never quite saw one like that. And when the distinguished congresswoman from the mountains of Georgia were saying, liar, liar, all of a sudden another started, and I said, well, he said, we don't want to cut it. So I went through it all. You may remember my sense that you're not going to cut Social Security Medicare. Holler, stand up. Well, a lot of them stood up. Tell the press they're all on camera. They all stood up. I sure hope it's true, but I'll believe it when I see it. You paid your Social Security and Medicare from the first paycheck you ever earned. And I'm determined to protect it. Let me close with this. 13 years ago, thanks to the leadership of Barack Obama and some of his staff are in this room here to help get that passed. So if I start to name them, it would take a long time. But I want to thank them. You made history when the Affordable Care Act came over. We changed America. We gave millions of people peace of mind. We did something else. We also took a giant step toward realizing the fundamental principle that we hold as Democrats and as Americans. That health care is a right and not a privilege. We're not all the way there yet, but there's more to do. So let's finish the job. Let's protect lower prescription drug costs for everyone. Let's expand health care coverage for more people so they get care. Let's keep building an economy from the middle out and the bottom up. And let's remember who we are. We're the United States of America. Nothing is beyond our capacity when we do it together. So God bless you all, and let's keep fighting together.
Distinguished guests, please hold the easel as the President and Vice President depart.